are from group 3. And today we would like to present to you about dengue hemorrhagic fever. But before we get started, we would like to introduce ourselves. My name is Benedicta Alia Samulya Harsanto.
My name is Fauzia Zerafifa.
My name is Raihan Raditya Maiswara.
My name is Kiva Kanita Patonangi. My name is Aldiaru Sabila.
My name is Alfia Fadila.
My name is Rajana Syaman Kamila.
My name is Pitayana Agustina.
My name is Zafira Zalfa Alkatsmargia.
My name is Ashifa Rahmajuana.
My name is Hana Fionita. So, without further ado, let's get started.
Dengue fever is an acute viral infectious disease caused by the dengue virus. According to the World Health Organization, dengue fever is transmitted through the bite of an Aedes mosquito infected with one of the 4 types of the dengue virus. Its clinical manifestation include fever, muscle pain, or joint pain, along with leukopenia, rash, lymphadenopathy, thrombocytopenia, and hemorrhagic tendency. In dengue fever, plasma leakage may occur, which is indicated by hemoconcentration or fluid accumulation in body cavities.
Dengue fever is an important public health problem with a wide range of symptoms. World Health Organization classifies dengue into 3 categories: probable dengue, dengue with warning signs, and severe dengue. A serious complication that may occur in dengue is secondary hemophagocytic lymphohistiocytosis, a dangerous condition that can be fatal. At present, there is no specific medicine that can completely cure dengue. Treatment is only partly focusing on maintaining and stabilizing the patient's condition. For this reason, many compounds and drugs are being studied for their potential anti-dengue effect, although up to now, no official anti-dengue drug is available.
We have arrived in the section of cause of the symptoms. Now we will tell you guys about this. Dengue fever is caused by high population density and unhealthy environment such as poor drainage. Many open water reservoirs which become breeding grounds for the Aedes aegypti mosquito.
The dengue virus is transmitted through the bite of the Aedes aegypti mosquito, a lack of public awareness of prevention or 3M+,
Our immune system, socio-economic factor that limit effort to maintain cleanliness and access to treatment. Nah, these are learning from all. Thank you guys.
Dengue fever has several symptoms that can help us recognize the illness early. These symptoms usually appear a few days after infection and may vary from one person to another. The first and most common symptom is high fever. The fever usually comes suddenly and can reach up to 40 degrees Celsius or more. This makes the patient feel very weak and uncomfortable. The second symptom is severe headache. This headache is usually very strong and often felt on the forehead. It can make it very difficult to do daily activities. The third symptom is pain behind the eyes, also called retroorbital pain. Patients usually feel pain when moving their eyes. This is a specific symptom that makes dengue different from common flu. The less common symptom is skin rash. It usually appears a few days after the fever begins. The rash can look like small red spots on the skin.
The fifth symptom is muscle and joint pain. Intense pain in muscle and joints, often called breakbone fever, making movement difficult. The sixth symptom is nausea. The feeling of stomach discomfort and loss of appetite may lead to dehydration if not managed. Seventh is vomiting, often accompanies nausea, can cause dehydration and requires fluid intake and rest. The eighth, swollen glands, lymph nodes, especially in the neck, armpits or groin may swell and feel tender due to the immune response. These are the common symptoms of dengue fever. Remember, if you or someone around you has these symptoms, it's important to seek medical help immediately.
To prevent this disease, the Indonesian government promotes a simple but powerful prevention campaign called the 3M Plus program. First is training atau menguras. This step involves cleaning water storage containers such as bathtubs, buckets, or jars regularly at least once a week. Mosquitoes breed in the stagnant water, so training is a very effective way to eliminate their breeding site. Second is covering atau menutup. Tightly cover all water containers such as drums, tanks, or other storage vessels. By doing this, mosquitoes cannot lay eggs and multiply.
And the third one is recycling or mendaur ulang. Manage unused items that can collect water, such as old tires, bottles, or cans. Communities are encouraged to recycle, reuse, or properly dispose of these items to avoid mosquito breeding places. And the additional prevention of methods, or 3M Plus, to strengthen dengue prevention, the community also practice additional step known as the plus part of the 3M program. The first one, apply abate powder at about 10 grams per 100 liters of waters every 3 months to kill mosquito larvae. And the second one, install mosquito nets on beds, windows, and ventilation areas to prevent mosquitoes from entering the house. The third one, wear long sleeve clothes and pants to reduce mosquito bites, especially during the morning and evening. And the fourth one, use mosquito repellents such as cream, lotions, or spray, preferably with natural ingredients like citronella or eucalyptus. And the fifth one, spread guppy fish in ponds or stagnant water areas. These fish eat mosquito larvae and help reduce their population naturally. And the sixth one, eat nutritious food to strengthen your immune system so the body can better resist infection during the dengue fever.
In conclusion, dengue prevention is everyone's responsibility. By applying the 3M Plus program, training, covering, recycling, and additional preventive action, we can work together to reduce mosquito breeding and protect our communities.
Until now, there is no specific medicine that can kill the dengue virus. The management of dengue fever is supportive, focusing on relieving symptoms and preventing complications.
This includes giving paracetamol to reduce fever or pain, avoiding NSAIDs such as ibuprofen or aspirin because they can increase the risk of bleeding, and ensuring adequate fluid intake either orally or through intravenous fluid if necessary.
Patients are advised to get plenty of rest, consume nutrition fluid such as juice or oral rehydration solution, and monitor their condition closely. In severe cases, hospital care is needed for fluid monitor and intravenous fluid administration. Dengue fever is a serious disease caused by the dengue virus transmitted through Aedes aegypti mosquitoes. It can lead to severe complications if not treated promptly. Common symptoms include high fever, headache, muscle and joint pain, and rash. Since there is no specific cure, proper hydration, rest, and careful monitoring are crucial in patient management. Prevention remains the most effective way to fight dengue. Everyone must take part by keeping the environment clean and free from mosquito breeding sites. Let's apply 3M+, drain, close, bury, and plus actions such as using mosquito repellent and maintaining household hygiene. Together, we can raise awareness, stop the spread of dengue, and build a healthier community for all.